A transient manifestation of abnormal, excessive, or synchronous brain activity that causes a loss of consciousness or convulsions. That is the definition of a seizure. What this means is that there's a bunch of electrical activity going on in your brain that's happening at the same time that's causing your muscles or causing your consciousness to disappear. Seizures aren't a disease in itself. Epilepsy, on the other hand, is a disease of recurring seizures. Now, epilepsy has a clinical definition. It is 2 unprovoked seizures within a 24-hour period. What is an unprovoked seizure, though? An unprovoked seizure is a seizure that has no identifiable cause. What this means is that I can't exactly link the seizure with any sort of certainty to a specific cause. What exactly is happening in the brain during a seizure? Now I want you to imagine with me a room full of 30 lights. These lights can be turned on or off by specific switches. For example, if I pull one of the switches, I would switch 10 of these lights on. I want you to imagine a power cut or a disruption to the generator that controls these lights. What would happen is that all of the 30 lights, regardless of the switches that are present on the wall, would start flickering at the same time. They would start turning on and off, on and off, on and off, and it would be extremely chaotic. Yet at the same time, they're all still turning on and off at the same time. This is sort of what happens inside your brain when a seizure does occur. You have neurons inside your brain, which are brain cells. These neurons tend to fire when they want to transmit a signal. What happens in a seizure is that a specific set of neurons start firing all at once. They start firing very, very chaotically, meaning they would turn on, off, on, off, on, off, on, off, but there's no exact purpose of them turning on and off. There isn't a message to transmit from one place to another. They're just turning on and off randomly. Yet they're all turning on and off at the same time. But here's what's fascinating. Depending on which groups of neurons are firing, specific symptoms start showing. This means that on the outside, seizures look completely different from one another. For example, say that a seizure happens in the area of your brain that is responsible for vision. What this means is that the neurons inside your brain that are responsible for forming pictures of things that you receive from your eyes sort of start making up things and hallucinations start forming. So that is one way a seizure can manifest. Now imagine if it happens in the area responsible for hearing. The seizure would manifest as specific sounds or clicks or perhaps voices. And this is true for every area of the brain. The one responsible for smell would have smell manifestations. The neurons responsible for movement would have movement manifestations. We mentioned that these neurons are firing on their own spontaneously. But what is it that's causing them to fire this way? Before discussing the causes of a seizure, it is important to mention that seizures aren't a diagnosis. They are symptoms, meaning that they are part of another disease or an underlying process. And that's why there are hundreds, if not thousands, of causes of seizures. However, we can group them up generally into a few categories. These categories can be summarized by an acronym called VITAMIN, where V stands for vascular causes. Vascular means related to blood vessels. For example, strokes. What is a stroke? A stroke is when a clot forms inside the blood vessels supplying different areas of the brain. Once this clot forms, it cuts off the blood supply to specific areas of the brain. And this causes that area of the brain to begin dying. This could trigger a seizure. I stands for infection. Some bacteria and viruses can gain access to your brain, and once they do, they start doing their thing over there, and this damage caused by these microbes might cause a seizure to trigger. T stands for trauma or toxins. Trauma meaning any mechanical damage to the brain. This could be through a gunshot wound, or it could be a very strong punch or a fall on the head. This may all cause compression of the brain or destruction of the brain, which may trigger a seizure as well. There are also some specific toxins that may gain access to your brain blood supply, and they may damage the brain cells or the neurons inside the brain, and that could also trigger a seizure. A stands for autoimmune diseases. Autoimmune meaning that the body's immune system starts recognizing the body itself as a foreign invader and starts attacking the own body. M stands for metabolic causes. Metabolic meaning things like shifts in the electrolyte levels. Things like sodium, potassium, calcium, these ions are very, very, very important in maintaining electrical charges or normal electrical charges at the level of the neurons. And if the levels of these ions are disrupted, that may cause a seizure to trigger because you're messing with the electrical activity at the level of the brain. I stands for idiopathic, meaning that there's no specific cause triggering the seizure, as in the case of epilepsy. Finally, N stands for neoplasm. Neo meaning new, and plasm meaning formation, new formation. This refers to growths or tumors that happen inside the brain. These tumors could be benign in nature, meaning that they are not cancerous, they're just a growth happening and compressing on the brain itself, which may trigger a seizure, or they could be cancerous, which means that they are cancer, they are spreading, but they're also growing and compressing the brain as well and taking away from its own blood supply. And that also can trigger a seizure. So as you can see, there are many causes of seizures. It is important to identify the underlying cause because it helps guide the management of the seizure and the underlying disease. The most important thing when it comes to a seizure is actually knowing whether or not it is a seizure. Now, you may be surprised, but there are a lot of conditions that mimic a seizure or look like a seizure. Now, I know I mentioned that seizures have different manifestations. However, there are common things that happen in a lot of the types of seizures. There exists a period after a seizure called the post-ictal period. Post meaning after, ictal meaning seizure. What's important is that during this period that comes after a seizure, a patient experiences a specific set of symptoms. These include amnesia, loss of consciousness, lost orientation to time and space. This is referred to as post-ictal confusion. This post-ictal confusion is very specific to seizures, and when it is there, it indicates that a seizure did occur. So now that we've discussed how to differentiate the seizure and what causes the seizures, let's jump straight into the types of seizures that may occur. Not all seizures are created equal, and certainly they're all not the same. In fact, as we mentioned earlier, they come in different types depending on which area of the brain they are affecting. Generally, you can classify seizures into two main categories. Number one, generalized seizures, and number two, focal seizures. Focal seizures are seizures that affect specific areas of the brain, as we discussed earlier. For example, these could be the areas responsible for vision. These could be the areas responsible for controlling your right arm or the left arm. The most important thing when it comes to these types of seizures is that they only affect a specific area of the brain. They don't affect the entire brain. If a seizure is affecting both sides of the brain and causing it to turn on and off, in that case, we would classify it as a generalized seizure. Now, generalized seizures can be further classified into subcategories. We can classify them as motor generalized seizures and non-motor generalized seizures. Motor meaning related to the movement of muscles or muscle contractions. One of the most common motor seizures is a seizure known as the tonic clonic seizure or a grand mal seizure. Tonic, in the word tonic clonic, stands for muscle contraction, and that is the first phase of this seizure. All the muscles affected by the seizure would all start contracting all at once, making the body very rigid. And this causes the person to generally lose their balance and fall down on the ground. Clonic meaning twitchy movements or jerking of these muscles. Other motor seizures exist, and they're classified in different ways depending on how the muscles are reacting to the seizure. You can read about them more down below because there's so many of them. There's no time to discuss them all. Now, for the non-motor seizures, the most important and the most common one out of them all is called the absence seizure. The absence seizure, and that's about all about the absence seizure. Okay, I'm just joking, but this is exactly what's happening in an absence seizure. There's a brief loss of consciousness for a few seconds or minutes, without any falling or any motor manifestations of the seizure, and then a regaining of consciousness after that. This most commonly happens in children, and this causes people to believe that a child is not paying attention to a class or to someone speaking. Absence seizures happen tens, if not hundreds of times during a day, and this is why it can affect a child very drastically. In fact, all the time, this type of seizure is misdiagnosed as ADHD. Remember when we mentioned earlier that a very important feature of a seizure is that post-ictal confusion that happens? Well, in absence seizures, this does not occur, meaning that when a person regains consciousness from the seizure, there isn't any confusion or headache or dizziness that occurs after. They just jump straight into it again. Obviously, there are other types of non-motor generalized seizures, but this is mostly the most important one and relevant one out of them all. Finally, I want to discuss what happens if a seizure starts but doesn't stop. This is a special type of seizure condition called status epilepticus. There are a lot of definitions for status epilepticus out there, but generally it is a seizure that doesn't stop for more than 5 minutes. Remember when we mentioned the lights and how the neurons are turning on, off the whole time? Well, what happens is when these neurons are firing constantly, this causes them to use up energy. And there's only so much energy around the brain as they continue to fire on and off. Eventually, these neurons begin to run out of energy and begin to die. This is why status epilepticus is considered a medical emergency and must be treated right away. This condition can be generally treated with special medicine called anti-epileptic medication, and if that doesn't work, then a patient can be put under general anesthesia and then given more anti-epileptic medication to stop the seizure, because if the seizure is allowed to continue, it can cause permanent damage to the brain and even result in death. So that's an overview on seizures. I hope you learned something. There's obviously a lot more to know. I just dove into the very superficial bits. If you want to read more, I left links down in the description to delve into the topic deeply. If you found the video informative, please consider supporting the channel. I would really appreciate it. Thank you very much. Have a wonderful day.